once this epic snowstorm along the East Coast eases up, a lot of people are going to have to be digging out. More than 2 feet of snow falling in many areas. And yes, shoveling snow can be dangerous even if you think that you're actually in pretty good shape. Thousands of people wind up in the emergency room every winter with, in fact, back or cardiac problems. So joining us now with a few precautions is Dr. Jen, is it Caudle?
That's right.
All right. Family medicine physician and professor at Rowan University in New Jersey. Thank you very much for talking to us. All right. First, so, when we think of heart attacks in this kind of weather, we usually associate them with shoveling snow and doing extra activity outdoors, putting so much pressure on the heart. But it's not necessarily just that physical activity that surprised me that can cause a heart attack. The actual cold temperatures can, too?
Well, that's exactly right. It's really the combination of the two. Just the fact of it being cold actually puts strain on the heart. And that's something that a lot of us don't really think about. And then you combine that with the stress of shoveling snow. I mean, remember, shoveling snow is not a small thing. It's almost like lifting weights, in my opinion. So when you combine the two of those together, you've got extra strain on the heart. And for some people, that can be a recipe for danger.
Yeah, and you're lifting that heavy snow, you're shoveling, you're putting stress on the heart, but it's not just the lifting of the shovel. I mean, even something as simple as walking through the heavy snow or snow drifts, as many people are doing today in some 12 inches and above, can actually strain your heart.
That's true. I mean, a lot of these snow drifts and walking through the snow. In fact, I actually walked to the location that I'm at now, and the snow is very thick. It's very heavy out there, and it takes a lot of exertion. And it's one of the things, but if you're watching this and you have certain heart or lung conditions, you've really got to be mindful of that before, number one, getting out there in the snow, and certainly doing any time of physical activity like shoveling or things like that.
Right. You say that being impatient with snow shoveling can also cause people harm. What do you mean by that?
Well, I see a lot of my patients. I'm a family doctor, and they see the snow outside. You see it outside. There's snow on the driveways, snow on the sidewalks. You want to get out there and clean it all away, and you want to do it all in one shot because you want to be done with it. And I understand that, but that impatience sometimes can cause problems. One of the best ways to stay healthy when you're shoveling is going slow and really listening to your body. So this is not the time to be a weekend warrior, not with this type of snow.
Yeah, I'm no weekend warrior. That's all right. All right, so go slow, don't be impatient. Your advice, though, for people who are out of shape or who are actually have underlying heart or even lung conditions, what's your advice?
Right. So the first thing is before you get out there and shovel, if you've got heart or lung conditions that are underlying, you've got to get the okay from your doctor first before you get out there and shovel. That's the first thing. But if you get the okay, for those of us who have to go out and shovel in the next couple of days, a couple things to keep in mind. Do it gradually. That means every few hours, go out there and shovel just a little bit so that the snow burden is a lot less. Also make sure that you're using, and this is a suggestion I love, is use a smaller shovel so that you're not piling on pounds and pounds of snow on your shovel, so it's easier on your back and your heart.
Okay, listen to your body as well.
And also push the snow.
Yeah, I mean, take it easy, and I love that idea of using a smaller shovel because then you're limiting the amount of heavy weight lifting that you're going to be doing. But if you've got chest pain, chest pressure, I mean, shortness of breath, dizziness, other symptoms like that, obviously you need to just pay close attention to your body. If you feel any of that, just stop.
Stop and call 911. Chest pressure or chest pain, absolutely, but listen to your body.
All right, Dr. Jen Caudle, thank you very much for talking to us. We appreciate it.
Thank you.